All right, hi everyone. In this PowerPoint, we're going to be talking about infectious diseases, bloodborne pathogens, and some universal precautions. All right, so pathogens, bloodborne pathogens are transmitted through contact with blood or other bodily fluids, whatever fluid that is. Generally, the saying is if it's wet, sticky, and not yours, don't touch it. Okay. Hepatitis, especially Hep B, HIV, the human immunodeficiency virus, are often serious concerns regarding this. Okay, healthcare facilities must maintain clean and sterile to prevent disease, infection, and the spread of that. Okay, which usually are really good. A lot of those protocols are kind of bumped up due to COVID, obviously, but a lot of facilities didn't really change a lot just because they usually have pretty high requirements. All right, infectious disease. Okay, so invasion of a host, animal or person, by a microorganism, usually we call that a pathogen. Okay, so causes disease by disrupting vital body processes, stimulates the immune system to react defensively. Okay, so the immune response, which is fever, inflammation, and other damaging symptoms. Okay, so most common pathogen, bacteria, virus, parasites, and fungus. Okay, so a pathogen is anything that can spread a disease. Okay, like bacteria, viruses, whatever it is. Okay. So the microorganism, can live in a host and be harmless until that agent and mode of transportation allows for transfer of that microorganism to become a pathogen and then to become an infection. Okay, so that infectious disease, so the contagious is contagious if transmission occurs from one individual to another. Okay, so it's either direct or indirect, transmission. The third types of direct transmission, contact with bodily surfaces like touching, sexual intercourse, those are the main ones. Droplet spread, so inhalation of air droplets. Fecal oral spread, feces on the hands in some way, then transmitted to contact with the mouth. Even though the fecal oral spread isn't very common, sometimes you'll see it brought up every once in a while. There was one about, it must have been 10 years ago, local here in the valley, of some kind of fecal oral spread. It was, I believe, this is what the news reported, given this in the news, so I'm going to hold my breath on some of that. But some of the fecal matter was being on oranges. So what was any kind of fecal matter out in the orchard was being stepped on, and then when the worker was going up and down the ladder, that now fecal matter or feces, whatever it is, got on the steps of the ladder. Well, when you climb a ladder, oftentimes you'll put your hands on the steps to climb up, and so that's how it got on the hands and then on the oranges and so forth. So that's what they reported caused that. Not saying that's really how it happened, but that's what they reported. Okay, indirect transmission, is travel. Okay, so you get water, food, towels, clothing, utensils, all that stuff that you kind of just make contact while you travel. Other vectors like insects, birds, animals, and then airborne transmission. Okay, so infected particles suspended in the air, and that's how you get infected via sharing that same kind of air supply. Okay, so the pathogen enters the body, through skin, respiratory system, digestive, or reproductive system. Okay, ability to generate infection depends on acquired immunity, which we'll talk about here in a little bit, overall health, and then health-related behaviors. Okay, so besides the acquired immunity, the overall health and healthy-related behaviors depends a lot on how you take good care of your body. Okay, do you get enough sleep? Do you eat? Is your diet good? Do you take good care of yourself, both mentally and physically? Is your health, your overall health, just good? Those factors play a big role. Like if you're diabetic, you're more susceptible to a lot of different things. Overweight, those are a few things you can control decently easily, but those are big factors. Okay, stages of infection. Okay, so there are 4. Okay, there's incubation stage, which from the time the pathogen enters the body to time the signs and symptoms first appear. Okay, lasts from a few hours to months depending on the concentration, virulence level of the immune response, and presence of other health problems. Okay, so then next is the prodromal stage. Okay, so this is your early signs and symptoms. Okay, so you'll water your eyes, runny nose, slight fever, malaise, which is like just general discomfort, may develop briefly. Okay, a host can transfer pathogen to another host. Okay, host should be isolated to prevent transmission. Okay, so whatever that is. Okay, I'm sorry, there's 5 stages. The third stage is acute stage. So the disease reaches the point of greatest development while the body resists further damage from pathogens. Okay. So this is you feeling your absolute worst at the acute stage. And then you have the decline stage, okay, which is the first sign of recovery. Okay. You could relapse if you extend yourself. Okay. Let's say you go back too early to work. You start doing a lot of physical activity, so forth, that kind of thing. Last stage, recovery stage. Okay, overcome the invading pathogen. The patient remains susceptible still. Okay, body may have built up immunity and will be resistant to future exposure. Okay, may or may not be permanent depending on what it is. Okay, but those are the 5 stages. Okay. Okay, so incubation. Okay, so when you get infected, whatever it is. Okay, prodromal, early signs, symptoms. Okay, acute, to really feel like the most absolute trash, and then you start to recover, the decline, and then recovery stage. So the immune system, okay, mechanical defenses, okay, separates the internal body from the external environment. Okay, skin's a big one. Like that's your biggest one right there. Next is mucous membranes. You don't have a lot of them. The bigger one's going to be like your nose one. The kind of inside of your gums is another one. Another kind of mucous membrane. There's some mucous membranes, I believe, around your eyes. That kind of stuff. Nasal hairs prevent you from inhaling some stuff. And a lot of the ciliary-lined airways. Okay. Next one is going to be your cellular system, which is your immune system. Eliminates microorganisms, foreign proteins, antigens. This consists of mainly your T cells and B cells. Okay. So the antigen triggers the leukocytes and macrophages to locate and destroy the antigen. Okay, so T cells facilitate the macrophages, and the B cells transform into specialized cells capable of producing antibodies. Okay. Antibodies neutralize antigens via lysis and phagocytosis. And then the memory T cells are formed to record information regarding antigens and immune response. Okay, so these T cells, what they do is they kind of, it's more of like your long-term memory of all these different antigens. So let's say you get infected with cold from the 1999. Okay, so your body remembers that cold, okay, in your memory T cells. So you kind of builds up some like antigen, some like immune response to them if it ever comes back. Okay, so let's say you get it again, that same strand of that cold in 2019, whatever it is. Okay, well, you have a higher chance of recovering quickly or not getting as severe of an infection. Immunity, okay, so after effectively managing invading antigens, the system is primed for future encounters. Okay, so acquired immunity, okay, developed through artificially through vaccinations, immunizations, or passively when antibodies are injected. Both can provide important protection against infectious disease. Immunizations right now, okay, we have diphtheria, okay, pertussis or whooping cough, Hep B, influenza type B. I'm not even going to try it and say that word. Tetanus, rubella, polio, mumps, chickenpox. So those immunizations have, over time, we've developed pretty good vaccines for them. So usually you get these when you're a kid. Every 3 months or so, you'll get some kind of vaccination. You'll get boosters as you get older and so forth. Immunizations have eradicated many infectious diseases worldwide. Epidemiology is a tool used to study infectious diseases and populations. So they have kind of a lot of breakdowns on the disease and like how big it is. Okay, so obviously pandemic, okay, COVID-19, there's one that we've all lived through, okay. Then there's epidemic, okay, which is a usually high number of cases in that region. Endemic is regular cases often occurring in that region. And sporadic is occasional and some kind of occasional occurrence. Preventing spread of infectious disease, okay, so must be diligent to in efforts to minimize transmission. Most effective practice is hand washing, which as of a year ago as I'm making this video, got overemphasized, which is great because a lot of people did not wash their hands enough for whatever it was. Being a male, I mean, the bathrooms, obviously people, they go do their business and then leave without washing their hands. Disgusting. Hopefully a lot of that has been minimized. I don't know. I haven't really been out in public a ton to see any kind of big change. But hopefully a lot of people are washing their hands after touching something infectious, or their hands are dirty, or handling objects, whatever it is. Okay. So obviously we saw a lot of the prevention of infectious disease during COVID times. Given I'm making this video in June 2021, so whenever you're viewing it, you've probably seen a lot of the preventive measures that we did over the past year, or whenever you're viewing this video. Kind of see how things have changed, how we've adapted, and so forth. And even then, as I'm making this video, some things we're going to realize probably after this recording that, you know what, we could have done better. We found out this is better for this, to prevent this disease, whatever it is. Okay. Obviously, we're still learning a lot about COVID, and as well as other diseases. I mean, COVID is the biggest thing right now. But we're doing a lot to prevent a lot of the spreads, the staying 6 feet away from one another, the masks that everyone hates, avoiding contact with one another, all those things to prevent a lot of the spreading of disease. And besides COVID, we have reduced a lot of the other diseases as well. The flu has gone down. I'm not saying it's eradicated, but the number of cases has gone down. I don't have any numbers in front of me, but the common cold occurrence has gone down, which is all good things. Whether they sum everything up under the whole COVID umbrella or not, but just everyone's becoming more aware of prevention. Shit, I remember during the height of all the COVID stuff, having to wipe down all my groceries. Now looking back, I was like, I was an idiot for that. But still, we didn't know at the time. All right, pathogenic organisms present in human blood and other fluids. Okay, so cerebrospinal fluid. Okay, semen, vaginal secretions, synovial fluid, which is kind of the joint fluid in the joints, can all potentially cause disease and spread disease. Okay, so whether you're working in like a hospital setting, a healthcare setting, your kitchen, whatever it is, you got to be aware of all these different kind of bloodborne pathogens that can be, whether excuse me, whether you cut your finger on a knife in the kitchen and you have blood everywhere, or you're in a healthcare facility and then someone sneeze. You don't see that too many anymore. That everyone's pretty aware of covering their mouth now, or they're spraying blood, or whatever it is. Okay, well, you be more aware of all the different bloodborne pathogens. Excuse me, especially because the most significant is Hep B, Hep C, and HIV. Okay, so virus reproduction. Okay, so the virus enters the cell. Okay, the virus invades the host cell and replaces all of it with its genetic information. That kind of host cell now thinks that it's producing antibodies when it's itself producing the virus itself, and then all those kind of viruses spread out it spreads in that cell, and the cell, like let's say, pops and spreads more of that virus to other things. Okay, as you see, I believe I have a video on HIV, which will go a tad more in depth on some of this, on just the HIV virus in itself. All right, Hep B. All right, so Hep B are all the Heps, okay, whether it's Hep A, B, C, D, I believe there's an E as well, attacks the liver. Okay, results in lifelong infection, cirrhosis, liver cancer, liver failure, and death. Okay, spread when blood from an infectious person enters the body of someone who is not infected, so unprotected sex, sharing needles, for example, are often ways to get any kind of hepatitis. Individuals who have been vaccinated are at virtually no risk for infection. Okay, so this itself is just for kind of Hep B. Okay, just know that. So signs, symptoms. Okay, flu-like symptoms: fatigue, weakness, nausea, abdominal pain, headache, fever, and possibly jaundice. Jaundice is yellowing of the skin and the sclera, which is like the whiteness of your eyes. Possible that individuals may not exhibit signs and symptoms. Okay, so they're asymptomatic. Okay, so asymptomatic is when they don't show any signs or symptoms. Just that's that terminology. Can be unknowingly transferred. Okay, chronic active hepatitis may occur because of problems with the immune system. Okay. So may test positive for antigens within 2 to 6 weeks of symptom development. 85% recover within 6 to 8 weeks. Okay, so prevention is good hygiene. Avoid high-risk activities. Proceed with caution as HIV can survive in blood and fluids, in dried blood and on contaminated surfaces for at least a week. Okay, so management, obviously vaccinations. If you get exposed on the job, obviously you have to, your employer will have ways of dealing with that. They'll have their own like protocols, whichever it is. Usually that's going to be in a kind of hospital, healthcare facility. Is where you would be hopefully the only place where there's a chance of being exposed. Okay. All healthcare professionals must be vaccinated. 3 doses of vaccine over 6 months. Okay. After second dose, 87% of those receiving vaccine will be immune, and 96% after the third dose. Post-exposure vaccination is also available after coming in contact with blood or fluids. Okay. Then on Hep C, both acute and chronic forms of liver disease caused by HCV, most common chronic bloodborne infection in the U.S., leading indicator of liver transplant. Okay, signs and symptoms: 8% of these infected have no signs or symptoms. Okay, so they're asymptomatic. So maybe jaundice, that yellowing, mild abdominal pain, loss of appetite, nausea, fatigue, joint muscle pain, and dark urine, which is pretty much everything after a hangover. All right, prevention. Occasionally spread through sexual contact. Okay, spread, really big is spread through contact with blood, so infectious person sharing needles. That's another one. Measurement of vaccine for HCV. Multiple tests are needed to see if you're actually positive. Okay, so even though a single positive test may not totally mean that you're positive, and same with a single negative test. Obviously, drinking alcohol can make the liver disease worse because the liver helps kind of filter out a lot of the different toxins like alcohol. Also, they may want to stay away from Tylenol. The acetaminophen, which is Tylenol, is really kind of harsh on the liver in itself. All right, immunodeficiency virus. Okay, so which is a retrovirus that combines with the host cells, infects the T4 blood cells, which produce white blood cells, and it weakens the immune system because obviously the white blood cells are now infected with HIV. High chance of secondary illness and cancer because your body now can't fight a lot of things because all your white blood cells don't work properly. Given I don't know when, I'm guessing both these stats are 2005. So estimated out of 11 out of 1,000 adults are infected with HIV. 4.1 million new HIV infections occur worldwide. Okay, so signs and symptoms. Okay, transmitted by infected blood or other fluids, mainly blood. Fatigue, weight loss, muscle or joint pain, painful or swollen glands, night sweats, fever. Antibodies can be detected in blood tests within 1 year of exposure. May go for 8 to 10 years before signs and symptoms develop. Most that acquire HIV will develop acquired immunodeficiency syndrome, so AIDS. Okay, so HIV and AIDS are the same thing. AIDS is just the last step, as we'll get to right now. All right, so there's 3 stages, okay, of HIV. Okay, stage 1 is acute infection. Okay, so within 2 to 4 weeks, individuals have the flu-like symptoms, highly contagious. Stage 2, clinical latency. Okay, so HIV inactive or dormant. Okay, HIV is active but reproducing very, very slowly. And this can last decades. Okay, and a lot of the drugs are really, really effective in this stage 2, and a lot of people don't get stage 3. Okay, stage 3 is AIDS, okay, which is the acquired immunodeficiency syndrome. Okay, so this is where your immune system is severely damaged. Increased number of illnesses. Without treatment, life expectancy is about 3 years. Okay, back in the day, I mean, this is 40 years ago. You probably ask all your parents, or some of you guys may have lived this. HIV and AIDS was a death sentence. Now it's usually not, but they're usually people still have complications, obviously, because their immune system can be compromised to an extent. But we did a really good job coming up with like the pills to keep it, I guess, more dormant. I don't know a ton about the medical side of the HIV and all like the different medicines out nowadays. I know they've come a long ways. Okay. Let's see. So prevention. Okay, so greatest risk is through intimate sexual contact with an infected partner. So make sure you choose a non-promiscuous sex partner and use condoms, obviously. Latex condoms provide a barrier against the HPV and HIV. Condoms with reservoir tip reduces chance of ejaculation being released from outside. Most condoms have a spermicide in them now to prevent any unwanted pregnancies. Just a little side note. Condoms should be single use. I hate to say that because it's usually obvious, but not for a lot of people, and should be carefully removed and discarded. Treatment. Currently, there is no treatment or cure, or there's no cure for HIV, okay, or AIDS. And then the antiretroviral therapy dramatically slows the disease progression. Okay, bloodborne pathogens in sports. Okay, so chance of transmitting HIV amongst athletes is low, very low. Minimal risk of on-field transmission. Some sports have potentially a higher risk for transmission because of close contact, like martial art, MMA, martial arts, boxing, wrestling. Football's up there too. Those are the big ones. And most sports or sport organizations have rules against blood exposure. Generally, the rule is if any individual shows signs of blood, they are removed from participation immediately until that blood is stopped and covered. Can they go back in? And if there's any blood on uniform or on the playing, whatever surface, mat, court, whatever it is, it has to be removed accordingly before that whatever participation can go back in. Obviously, some sports that do not follow this. Okay, boxing's one. You see, boxing is not a college sport for obvious reasons because that is a college rule. MMA, obviously they bleed all over the place on each other and so forth. I think those are the two, but those are the major rules regarding any kind of bloodborne pathogen. Policy regulation. Okay, so athletes are subject to procedures and policies related to transmission of bloodborne pathogens. Obviously, I just mentioned those. Organizations also should have developed educational programs concerning prevention and medical assistance. Wrestling is usually the leader in this because they usually have a number of infectious issues. This goes along with the sport. They usually have higher infection rates than others. Not just general illness, but like other like transmitted diseases because there's such close contact in such a usually a warmer environment than most. At the high school and middle school levels, parents should also be educated on like general like care and prevention because a lot of time their children that play sports don't care. Working in a high school for 10 years, a lot of time they don't care. Most athletes aware that high risk is involved in off-field activities. Obviously, institutions should implement policies concerning bloodborne pathogens. All do, and they have to follow the OSHA protocols. HIV in athletic populations. Okay, there's no definitive answer as to whether asymptomatic HIV carriers should participate in sports. Okay, so whether, let's say that individual has HIV, but they're asymptomatic because they have no symptoms, can they play in sports or not? There's no definitive answer. Okay, obviously body fluids contact should be avoided. Avoid exhaustive exercise that may lead to susceptibility of infection. Okay. Americans with Disabilities Act, okay, so ADA, says athletes infected cannot be discriminated against and may only be excluded with medical sound basis. Okay, so it must be based on objective medical evidence. Also must take into consideration risk to patient and other participants and means to reduce risk. Okay, so let's say someone has HIV, you can't say they can't play sports. Long story short. Based on just that alone. Testing athletes for HIV, you cannot use this as a screening tool. That is highly illegal, and you'll be fired and lose your job, and it's probably sued. Okay. Mandatory testing may not be allowed due to legal reasons. Obviously, testing should be secondary to education. Athletes engaged in risky behavior should undergo voluntary anonymous testing for HIV. It's recommended for them to disclose it to the appropriate individuals. Okay. It may not be a coach. It could be, let's say, like the athlete trainer, team physician, for example. It's recommended. Just that way they can keep better mind. Like, let's say, me myself working as an athlete trainer covering that sport. I know when my individuals has HIV, whatever it is. I would just not do really anything different, but I would be more wary of any kind of possible breakage of the skin, blood infection, any kind of item like that. Protection. Many states have enacted laws that protect confidentiality of HIV. Medical personnel should be familiar with state laws that maintain confidentiality and anonymity of testing. All right, on to OSHA, which is the Occupational Safety and Health Administration. Established standards for employers to follow and govern occupational exposure to bloodborne pathogens. Okay. Developed to protect healthcare providers and patients. In the sports realm, okay, should have a control plan, including counseling, education, volunteer testing, management of bodily fluids. So let's say you're working in a healthcare setting or wherever it is. Okay, so prior to participation, all wounds. Sorry, this one's more a this is not a healthcare setting. This one is on a like athletic setting. So prior to participation, all wounds should be covered with a dressing that will not allow transmission. Okay, so some kind of occlusive dressing lessens the chance of cross-contamination. Okay, which is not a Band-Aid. Okay, a Band-Aid does not fit that requirement, believe it or not. So occlusive dressing is what you need. Okay, so a hydrocolloid dressing is considered a superior barrier. Reduces chance that the wound will reopen as the wound stays moist and pliable. So I have one right here. This is a big one, obviously. This is a 4x6 dressing. Okay, and this is by Hartman. This is a hydrofilm. So this is a transparent barrier. Okay, so if I open the package, okay, it looks like this. The downside of these is they're kind of pricey. Okay, so obviously this is one that you want to make sure that wherever you're working that they have funds to supply proper equipment for this. Because Band-Aids work, but they don't provide a kind of that barrier between, because blood can still soak through a Band-Aid. If you put on gobs of gauze, blood can still go through that. Okay, so they can still potentially be infect other people. Okay, so let's say someone has a cut. I want to make sure that it's properly covered before it is. So I would take this dressing, and it's numbered to show you like how to open it. So I would take off like number 1. So I would take that off. Okay, so it shows the sticky side. And then here's the second one. But I can still have gauze under this. Okay, so just know that. Okay, so then I would put this directly on. There's a third little thing I take off too. And this is a very, very nice barrier. They can even shower this on and nothing's going to get through this. Okay. The only downside is it's a little pricey. Okay. So obviously all this does a really, really good job. And this stuff is really sticky. I didn't want to put it on myself because I was just going to wax everything off. Of making sure that nothing kind of gets through it. You have to be very careful with it, and I'm not right now, because once you get it on, it's really kind of hard to get off, and it kind of goes on everything. Let me put it on my thumb. Okay, they can really kind of get this on decently tight. Okay, and it'll stay on there. Okay, and this is transparent. Okay, so you can kind of barely see it on my hand. Okay, but I can still move perfectly fine with it. But this is the ideal thing you want to use, okay? Because if I had a cut underneath it, nothing would come through this, okay? Unless it, for whatever reason, is torn or cut or whatever it is. I may put other things over this to make sure that this isn't cut by itself, because it can still cut and rip and so forth. Oh, this is going to start taking off. Oh, I'm just going to wax myself. But that's the proper dressing to do before someone goes to sports. Personal precautions. Okay, so when bleeding out occurs, okay, in the sports realm, athletes with active bleeding must be removed from participation. The bloody uniform must be removed or cleaned to remove infection. Personal precautions. Sorry, I'm ripping this off right now, and it's kind of hard. Okay. Those with direct contact must use appropriate equipment, obviously. Gloves, gown, aprons, masks, eye shield, eye protection, disposable mouthpieces, if resuscitation is used, etc. And all of those should be in some kind of emergency kit that is there for all sports. For some people, dubbing gloves is suggested with severe bleeding or use of sharps. Okay, some kind of sharp instruments. Like a lot of paramedics will take double glove before handling some medications and so forth. Extreme care must be used with glove removal. Okay, that's very, very important. Hands and skin surfaces coming into contact with blood and fluid should be washed immediately with soap and hot water. as some kind of anti-germicidal agent. Hands should be washed in between patients, and pretty often. When I'm practicing, I usually get a hand soap that has a lotion component to it as well, because when you're washing your hands 80 times a day, they really, really dry out. And so this really kind of helps. And I'll drop some money on some good hand soap, just to make sure they don't dry out, because just washing my hands, I would make a fist and my knuckles would crack open and bleed, just from how dry my hands would get after a few days of washing. So if you are in a setting where you have to wash your hands a lot, ask your boss of, hey, can we get some really good hand soap with some lotion in it? Highly recommend it. All right, latex and non-latex gloves. Non-latex gloves is recommended nowadays, just because the high allergic reaction rate of latex in a lot of individuals. Okay, some of it's just kind of contact dermatitis, so wherever you touch them, they're going to break out in hives. A lot of time you want to use just anything non-latex, because let's say it's not that just contact dermatitis, but it's a system-wide reaction. Okay, so you want to use some kind of non-latex gloves, and most of the time you can't tell the difference nowadays. But you got to make sure that box will say latex-free. Where's it on this one? Not made with natural rubber or latex. Okay, so I have a box here. This one is Halyard. Okay, so this is one that we use commonly. Does a really good job, fits my hands, and so forth. A lot of people don't really know that they are allergic to latex nowadays. A lot of people are being really, really find out kind of a little bit later on that they have this allergy. Availability of supplies and equipment. Okay, so chlorine bleach is a recommended product by a lot of places because it kills everything. Antiseptics. Okay, proper receptacles for equipment and uniforms, whatever it is, should be available. Wound care equipment and sharps containers. Okay, all really, really important things. So for most things, let's say someone has a bloody jersey, you could put that directly into a biohazard bag, or just a regular bag that you can mark biohazard, usually with red, or if it's really, really kind of soaked with blood, I'll put it in a regular trash bag, and I'll put that into a biohazard bag. There's a biohazard bag, it's just a red bag, okay, bright red, which you should carry, okay, especially if you're working any kind of medical facility. You should not put any kind of biohazard item in the regular trash can. Most sharps containers is going to be a solid plastic container, okay? Because a sharps container is made for needles and scalpels and anything kind of sharp related. Okay, that's hard, and you're going to dispose of that entire container. Okay, you're not just going to empty it out; the whole thing's going to go. Okay, so then you got to buy a whole new container, which you don't really fill up that quickly. I'd only really kind of empty out my container maybe every few years. I'd buy a new one, and they're not that expensive. They're maybe $10-15 for that, but it's really important to have it. Usually that trash can, let's say that you dispose of all your biohazard material, should be labeled with the symbol. The old symbol was the skull and crossbones, but once Pirates of the Caribbean came around, kids thought that's where all the treasure was, so they had to change it to this. Okay. Most facilities will have someone come out and dispose of all their biohazard containers. Just literally ask your boss wherever you're working, and they would send individuals to come just pick it up themselves. Okay, removal of gloves. Okay. So I'm going to use these nice ones. So when you're using gloves, make sure they're the right size. Really, really important. If they're too loose, they can get kind of baggy and it's kind of hard to handle things. Okay. So a large fits me perfectly. I wouldn't recommend like someone who wears large gloves try on like a small because you're just gonna rip the gloves. And it just like feels a lot better if you're wearing an appropriately sized glove. Okay, they're not like falling off you, for example. Okay, so let's say whatever item. Okay, let's say I have that hydrocolloid film here. I use. Let's say I have any gauze from any of my previous recordings. I have. Okay. Let's say it's all bloody, whatever it is, and I'm going to dispose of it. Okay, but there's only a little bit. Okay. So what I'll do is I'm going to put it all in one hand. Okay. And there's no sharps in this at all. Okay. And then I'm going to take right here in the middle. Okay. I'm going to pull up. I'm not going to go underneath. Okay. Because if I have anything on this hand, okay, which is you want to assume that there's something on this hand, okay, you could get it in contact with my skin. Okay. So I'm going to come right here. Okay. I'm just going to pull that. I'm going to pull that nice and over. Okay. I'm going to trap all that biohazard materials in this glove. Okay, I'm going to take that, I'm going to put everything in this hand. Now I'll come underneath with a bare finger, and I'll pull that over. Okay, so now it's kind of double contained. Then I would toss this in a biohazard container. All right, disinfectants. Okay, so I mentioned bleach earlier. Okay, so bleach is a common one. Does a really, really good job. So any kind of contaminated surfaces should be cleaned immediately with a solution of 1 to 10 ratio approved disinfectant. Bleach is a good one. If you are dealing with somewhere that has a lot of asthmatics, you may want to go to another kind of disinfectant, just because bleach kind of triggers a lot of people with asthma. Okay, just know that. So you can get a lot of other disinfectants, and then usually concentrate it and you would dilute it, okay, with water. Okay, we'll say I'm using bleach, okay, because I like using bleach a lot. I like the smell of it. I like knowing that it smells clean. All that means is 1 part is water. Sorry, 1 part is bleach and 10 parts of it's water. Okay, that's all that means. I'm going to put it in a spray bottle, and when I clean something, I'll clean whatever surface with like soap and water, okay, because that cleans it. Then I'm going to disinfect it with that bleach solution. Okay. So even though I'm spraying whatever it is on it, this is a disinfectant. This is not cleaning. Okay, there's a difference. Cleaning should come before disinfecting. Okay, a lot of times if it's not dirty, you don't really need to clean it. You can just disinfect it. That's fine. But I wouldn't just spray straight disinfectant on something that has to be cleaned. Okay, you should clean it first. Okay. Whatever it is should inactivate HIV, especially if I'm using kind of spray bottle solution. I'm going to spray it on, and I want it to mix with the air. I don't want just straight whatever solution. I want it to mix with the air. So make sure you mist it on. So I'll mist it on. I'm going to wait at least 30 seconds just for all that solution to kind of do its job and disinfect everything. If it's like really kind of soiled with like blood or vomit, whatever it is, okay, after I clean it, I'm going to spray it on. I'm going to wait longer. I might wait 5-10 minutes, or I'll let it dry on its own, and I'll spray it again, and then I'll wipe it. Okay. Contaminated towels should be bagged, labeled, and separated, and done washed separately. So the water should obviously be really hot, 160 for about 25 minutes. Okay. If your laundry is done outside with your institution, it should be OSHA certified. Okay, facility. And a lot of places will do that, especially like sport places. They'll send their stuff out. A lot will do on site. Like here at Fresno City, we have our equipment manager that he does all laundry on site, follows all the regulations. Both equipment managers do a really good job on that. But some places, like when I was working at the high school, he would send all the equipment out and all laundry to be done over summer. That way it's like professionally done, and then you can store it for whatever over summer and then reissue it the next whatever season. They would have a facility come out and OSHA clean everything, because the worst smelling thing in the world in athletics is a lineman's gloves. So if you know a lineman, ask them that question: how bad do your gloves smell in high school? Because they do not wash them to save their lives. and it smells like something died in them. And they go and they touch other people's like jerseys and the face and everything else, and it's disgusting. All right, sharps. I mentioned this earlier. Okay, so this is a sharps container. It's a hard plastic. They're almost all red. So like needles, razor blades, scalpels, all go in here. It's a one-way, I won't say valve on top, but entrance. So once you put it in, you can't get it out. Extreme care should be used when handling any kind of sharps items. Do not recap, bend needles, or remove from syringes. The whole thing goes in there. Scissors or tweezers should be sterilized and disinfected regularly. Okay, so I can't think of the device that sterilizes. So a lot of like medical facilities, when they reuse a lot of their like scissors or tweezers or like the scalpel like handles, for example, or maybe even so like some of the scalpels, they'll go through a really kind of thorough cleaning. So it will be in a they'll kind of like scrub down to get off anything. And then they put in a disinfectant solution, and then they put in a, the name escapes me, but this is high temperature kind of sterilization. And then those things get rebagged individually. That way they stay sterile until used. All right, protect yourself. So OSHA guidelines are designed to protect coaches, athletes, medical professionals against any kind of infection. Coaches generally do not come into contact with blood, therefore risk is greatly reduced. Responsibility of institutions to protect staff and provide necessary supplies and education. Personal responsibility to follow guidelines. Okay, so minimize risk is by not eating, drinking, applying cosmetic, lip balm, handling contact lenses, touching face before, hand washing, that kind of stuff. Protecting the athlete from exposure. Okay, so like mouthpiece is a big one. Because football, for example, they like to cut their mouthpieces. And so they're not like bound to the mask. They'll fall on the ground. They'll get mixed into whatever is on the ground, in the grass, dog feces, whatever it is. And they'll take them off and they'll throw them right back in their mouth. Okay, so obviously mouthpieces are an item. They should be cleaned pretty regularly. Showering immediately after practice or competition is highly recommended. A lot of athletes really kind of are frown against that for whatever reason. They're embarrassed, whatever it is. In college, it's usually mandatory for a lot of sports, like wrestling. Wrestling has to shower after every practice competition. And it's a really, really big thing. Because let's say I get a ringworm on my arm, wrestling, okay, during that match. If I shower immediately afterwards, I don't have to worry about it. But it's the athletes that, let's say I'm a wrestler, for example, okay, because they're always big on the skin funk. High school was always a big one because they would get done with practice, they'd go home, they'd eat, they would maybe do homework, and then they would shower, or they would just go to bed and maybe shower the next day. Okay, and so they'll kind of sit on their skin and let that kind of, whatever that item just kind of like get in there. So that's why it's really, really important to shower afterwards, because you get everything off of you. And your risk of infections is really, really greatly reduced. So athletes exposed to HIV and Hep B should be evaluated and immunized against that. Or I guess just just Hep B for that. All right, hand washing. All right. So length of time, minimum 20 seconds. Minimum 20 seconds. Okay, which isn't like a stupid amount of time. But you want to, I'll take your time. Okay. Hand washing versus hand sanitizer. I thought it was great on campus when they put in all these hand sanitizers all over campus, which is not a bad idea. Don't be wrong, not a bad idea. But it minimized hand washing at that time. I mean, this was just like a few years before COVID. Hand washing cleans your hands. Hand sanitizer sanitizes your hands. Know the difference. Okay. So you always want to clean before you disinfect. Okay, so I clean my hands and then I disinfect them with hand sanitizer. Okay. Um, Hand sanitizer should never replace hand washing. In an emergency, it can work. Okay, but it should never replace it. Type of soap, it really doesn't matter that much. Antimicrobial soap is a lot of soaps nowadays, and that's the recommended one. Um, Foaming soaps are great. They look nice. They feel good. They get no little cracks. It's really important to get through everything in your hands. A lot of different medical facilities will have you avoid doing anything to your nails because they don't want long nails. They usually want decently short nails to prevent spread infection. Um, and you can't have any colored because you hide anything underneath. So I think most places will allow a clear coat. If you want or you work in any kind of healthcare facilities, a lot of time that is a common thing. Get underneath your rings, okay? If you would take it off or work things in under there a little bit. Always important. Also, if you're wearing gloves to the ring, I'd recommend getting like a silicone ring or a necklace to keep a ring on because a lot of times if you have a diamond on there, that will cut through your gloves. So I don't recommend that. But a lot of people in healthcare facility, they'll just get like a silicone ring, which is like a plastic ring that bends. And it fits under gloves pretty easily. Let me see. With hand washing, especially to like when you hand wash, I think I'll have a video of it later on, maybe in this module. So you can make sure you get like all your nails and the webbings around your thumb, back of your hand, and so forth, areas that are commonly missed. You should also use hot water, as hot as you can tolerate. Okay. A lot of places will say, well, any temperature water works. No, as hot as you can tolerate. Not saying you have to like scald your hands, but it'll get like something like good like warm water. Okay. Lotion wise, I highly recommend like some kind of like hand lotion because if you do like hand washing, your skin will crack and then any kind of bacteria can get in that crack. Okay, so preventing your skin from cracking is another big thing. And that is it. 52 minutes for this recording.